Optimising Future Health. Webinar recording hosted by the Alliance and Scottish Government. Good afternoon, everybody. Welcome. I'm Jennifer Stewart from the Health and Social Care Alliance Scotland, and I'm going to be chairing today's session. So this webinar falls within our series of information sessions that we at the Alliance have been hosting in partnership with the Scottish Government on women's health and in support of the Women's Health Plan. Many of you will have been to one of our previous sessions, but for those that are new, our kind of aim with these sessions is really to raise awareness about key areas of women's health that maybe we don't speak that much about, or there's maybe quite a lot of questions around. So yes, we try and raise awareness, but also importantly challenge any myths and kind of stigma that might still surround some of these areas. We've previously ran quite a few sessions on the menopause, as well as kind of things like menstrual health and specific conditions. And so today we felt that it was really quite important to now turn our attention to beyond the menopause and discuss some experiences that are common for women later in life. And that's really because life post-menopause can bring with it some specific risks that might impact our health. And we'll focus on a few of these today, so things around bone health and things around heart health. But there's many things that we can all be doing, really at any age, to support our healthy aging, so that we can all live well for longer. So our first speaker today is Dr. Becky Howie. So Becky is a GP and GP appraiser from Lanarkshire. She's a certified lifestyle medicine physician, which examines the impact of lifestyle choices on health, longevity, energy, and overall well-being. Dr. Howie adopts a holistic, person-centred approach to healthcare, emphasising the significance of lifestyle modifications in conjunction with medical treatments to enhance health and well-being. So Becky's going to really approach this idea of kind of healthy aging for women from that kind of holistic perspective that she's a specialist in, and really explain how we can all kind of navigate certain kind of behaviours or navigate the life course with a view to kind of making decisions that support our long-term health. So yeah, touch on some key areas and give some kind of helpful tips for us all. So Becky, I'm going to pass it over to you and we'll get your slides up on the screen.
Thank you very much. Yeah, that's probably the best introduction of myself. I sound very professional, which is fantastic. Thank you for the introduction. I guess maybe useful to say why I got interested in lifestyle medicine. And I think it really came out of the fact that I've been a doctor for 20 years now. And one of the things I've noticed is actually a lot of people are kind of more unhappy than they used to be. They are becoming sicker in lots of ways that we can't explain. There's an awful lot of people who are tired all the time. As they're aging, they're having more and more issues with aging. And that really piqued my interest in, well, what's the kind of science behind how we live and the kind of behaviours we should have to age well. So that's what I'm going to try and cover today. So next slide, please. So we need to start with looking at these two different descriptions of life. So we have lifespan, and we think about, what's the lifespan, average lifespan for a woman in Scotland. And actually, on average, and it depends where you live from a demographic point of view, but the average female life expectancy is 80 years, which is pretty good. That's not too bad. But the big issue really is what is called our health span. So that's how many years we live in good health, where we're not needing help to do our day-to-day activities, that we feel well, we have energy. And actually the kind of current numbers in Scotland is about 60. So that would suggest that we're spending quite a lot of our lives in ill health. About 20-25% of our life might be spent in ill health. It's quite a significant part of life. And I think it's really important that we don't just plan to live a long time, but we plan to live full, happy, healthy lives for as many years as we possibly can. it's really good to have a think about what health actually means. So the World Health Organization have a definition of health, which describes it as a state of complete physical, mental, and social well-being, and not merely just the absence of disease or infirmity. So there's probably quite a lot of us that actually, based on that definition, are not necessarily in good health right now. We may not have diseases, but we do not feel complete physical, mental, and social well-being. So hopefully, as we dig into sort of healthy habits and things that we can adopt, you'll be able to take away some hints and tips as to how to improve our health at this stage of life and going forward. It's probably useful at this point as well to compare Scotland across the globe. And often Japan is used as a country of comparison from a health perspective. And if we looked at the lifespan of a woman in Japan, it's actually 87 years. So they get an extra 7 years of lifespan, and their health span is about 74 years. So they also get longer health span too. And people say, well, it's just a different genetics. But actually what we're finding in Japan is as the Western lifestyle is being adopted in Japan, that health and lifespan is decreasing. So it's not just about the genetics of Japanese women. There's something that they're doing in the way that they live traditionally that is improving not just their longevity, but also the health that they live in the years as well. So next slide, please. So if I asked you, what are the diseases that really worry you? And I ask, when I talk to patients, these are the kind of 5 main things as we get older that worry people. Dementia, obviously, most people will have a loved one or know of a loved one that has suffered from this really awful condition. So dementia is something that really worries people a lot. Cancer is another one, cancer of all different types. So we often think about breast cancer or ovarian cancer for women, but there's lots of other cancers as well. Heart disease is a big problem for women. It's actually the #1 cause of death for women, and yet we don't give it an awful lot of press. We often think of heart attacks as being men that have heart disease and not women. So that's a really important thing to consider as well. Osteoporosis, which I'm sure many of you have heard of before, and osteoporosis is basically where our bones have lost their mineral density, have become more fragile and weakened, and it puts a much bigger risk of having fractures if we fall. And then also just the falls and frailty that come with old age. So, people stop being able to do their own shopping, stop being able to go out of the house, they become housebound, they can't visit friends, can't go and see family. And these are the sort of things that really tend to worry people as they get older. And so next slide, please. So we've got some good news. The first thing to say is your genes are not your destiny. I hear a lot of women talk about, oh, well, this disease runs in my family. It's just going to happen. And they have a very kind of, they've given up on even trying because they're convinced that because their mom, their gran suffered certain diseases, that they're bound to get them. Well, the good news is that there's this part of genetics called epigenetics, which is really the study of which genes switch on and switch off and why they switch on and switch off. And so you may carry the genetic risk of type 2 diabetes, Alzheimer's, different conditions like that. But actually, it's not a given that those genes are going to express themselves and become those diseases. There are lots of environmental and lifestyle factors that influence whether those genes are active or not. And the reason we know that is because we've monitored and done lots of research on identical twins who share genetic material. And when we watch the impact of lifestyle choices and environment on identical twins, we see different diseases being expressed depending on how they've lived their lives. So this is definitely about good news. It's about putting you back in the driving seat of your health. It's about encouraging you, to take ownership of your health and to believe that you can have a long, healthy, happy life, no matter what age you're at. So next slide, please. So I think what's really important is to think about it, that you really need to put these habits into place as soon as you possibly can. So this isn't waiting until you're 40, 50, 60 to do these sort of changes or waiting till post-menopause. It's really starting these healthy habits as early as you can. This slide sort of describes that these conditions, the heart attack that you have, the Alzheimer's, they don't suddenly happen at 50 or 70. They've been gradually progressing in your body very slowly over several decades. So the sooner you can put these healthy habits in, the better. we start to age from the moment we're born. It's a bit of a depressing thing to think about, but ultimately our bodies are constantly aging. And so the quicker we get our heads around that and realize there's things we can do to improve our health, the better. Really, how you want to be as an older person starts today. It starts with how you live your life, small habits, small behaviors that you do consistently that will mean that you age in a much better way. So just the next slide, please. So what are these healthy lifestyle changes that we're talking about? And the six main ones here really are healthy diet, physical activity, sleep, reducing harmful substances, healthy relationships, and stress management. And the other part of that slide there is a piece of American research that looked at which lifestyle factors had an influence on your risk of death after the age of 40. And you can see there that the more of these lifestyle factors you adopt, the even better your risk reduction is. So, if you just adopt one, you've got a 26% risk reduction. If you take on all six and really start to improve these six different parameters, you have a much bigger risk reduction of death. And again, as we said, it's not just about prolonging life, it's also having a really healthy aging process. So we're not just talking about preventing death, we're also talking about embracing and empowering life too. So we're going to spend a little bit of time on each of these headings. I could probably do a webinar, if not a series of webinars, on each of these individual topics. So it really is going to be a whistle-stop tour through them. And I apologize that there's not a lot of time to really dive into each one in a lot of detail. But what I hope is that I pique your interest, that I make you just be inspired to go and read up about these different areas of life and how to improve our health. So next slide, please. So let's talk about healthy diet. And one of the things I really dislike about the word diet is the way that we use it in the sort of diet industry, and this idea that I'm going on a diet, which to me, I mean, I'm sure all the people watching here, or a majority of people watching, have been on a diet at some point in their lives. The problem with going on a diet suggests that that's something you come off, that it's something you do for a very short period of time, rather than it being a lifelong change. And so really what I want to talk about is lifelong dietary habits, patterns, ways of eating that you embrace now and you continue for your whole life. So this isn't about going on some strict diet tomorrow where you only eat cabbage or you do some sort of really faddy type way of eating. This is really about having nourishing your body and eating in a way that really builds health. So the key points, and there is a wealth of information out there about how we should eat. Social media, diet industry, there's a lot of money to be made in convincing people about how you should eat, selling products about how you should eat. But it's really, really kind of simple. And I appreciate that this is maybe oversimplifying it for some people. But I think if you stick to these principles, you can't go far wrong. So the first thing is we should be eating real food. So by real food, I mean food as it's made in nature, not food made in a factory, but food that's made in nature. Of course, you can, cook it, you can prepare it, but as close to how nature makes it, the better. So that means avoiding highly processed foods, and we'll talk a little bit about ultra processed foods in a moment. But it's really also thinking about the whole grain version of food. So we have taken a lot of foods like, for example, rice, and we have processed them, stripping fiber out of foods. Same with flour. We've taken it and turned we've taken a lot of the whole grain away, and we've ended up with white bread, white rice, products that have lost their fiber contact. So again, it's about the product being as close to how it appears in nature. So really trying to include those whole grains. Plants are massively important. If you can increase your plants in your diet, you will be covering all the micronutrients that you need. You will be the supplement industry is built on the fact that we're not eating enough plants, where if you can get a good variety of plants in your diet, your supplements are probably not all that necessary unless you really have, significant diet restrictions. So the sort of plants we're talking about, everybody thinks about fruit and veg, but we're also talking about things like lentils, chickpeas, nuts and seeds, herbs and spices, All of these things count as plants. Again, if you were talking about fruit and veg, as some of the plants that we eat, it's really trying to eat the rainbow. So the vast different colors of fruits and veg that are available, because each of those different colors brings different micronutrients with it. So the more variety we can have in the diet, the better. And then we could move on to the other part of nutrition science about the gut microbiome. And again, that could be a whole series of webinars on the gut microbiome. But go and read up about it. Go and read how to feed your gut microbiome with the right kind of foods. Other big area we need to talk about is ultra processed food. So unfortunately, about 57% of our UK diet is made up of ultra processed foods. And these are foods that are edible food-like substances. So they're stuff that's made in factories that is so far removed from actual food that it's really a factory produced product, and we are eating a lot of these kind of foods. And the way that you recognize them is if you look at an ingredients list, you're looking for ingredients that you know what they are. So if there's ingredients that appear and you think, well, I have no idea what that is, I wouldn't have that in my kitchen, you're pretty confident that that is an ultra processed food. And the problem is that a lot of what's being sold as health foods that have high protein across the packet, or their diet foods, their low calorie chocolate bars, a lot of those are really ultra processed foods. So we think we're doing the right thing. We think we're picking good foods because they've got these health claims on them, but quite often they're ultra processed. And what we're finding is that the ultra processed foods are being associated with an increasing number of different diseases. So it's really important to try to reduce them. Next slide, please. Physical activity is a really important part of a healthy lifestyle. And I think what's important to say here is that I'm not saying you have to don on Lycra and be in a gym, but just learning to move your body more can be really, really effective. And the current guidelines for physical activity is 150 minutes of moderate activity a week. Or if you want to be more efficient with your time, 75 minutes of intense activity. So moderate activity would be something like going for a walk where you can speak in sentences, but you couldn't sing, you'd be too breathless to sing. Whereas intense activity is more where you can only do 1 or 2 words at a time because you're pushing your body much harder. 150 minutes would be the equivalent of 5 30-minute walks a week. So something that is doable to fit into your routine would be a 30-minute walk 5 days of the week. So it's not as difficult as it sounds. And I think the key is about taking guidance like that and just chipping away at it and trying to find the time, 10 15 minutes here, 10 15 minutes there. It all adds up to that 30 minutes. The other really crucial thing for women, which we are not good at doing because I think we're afraid of becoming bulky, is resistance or weight training. And this is absolutely crucial for preventing osteoporosis and something called sarcopenia, which is the loss of muscle strength that we get, particularly post-menopause. And we should be doing two sessions of resistance or weight training a week to build those healthy bones and those healthy muscles, around about 30 minutes each of those sessions. Now, yes, you can go to a gym to do that, but there's also a lot of stuff on YouTube, online about how to build resistance and weight training into your week. What are the benefits of moving your body? Well, we know it's really good for mental health. It improves sleep. It reduces cancer risk. If we're talking about body aesthetic and wanting our bodies to look different, building muscle is a really important way to do that. It also improves your cholesterol and your blood sugar levels. What would my tips be? Listen, I know we're all really, really busy and trying to find time to do exercise is really difficult. But the easy, simple activities would be things like avoiding prolonged sitting. So trying to, get up when you've been at your desk for a while, walk around the room. When you go to make a cup of tea, do a little walk while the kettle's boiling. Even things like doing some squats while the kettle's boiling, or, there's lots of different little exercises that you can do. So we call them exercise snacks, where you just do, a minute or two of some physical activity. And then the other important thing is flexibility as well. So it's really important that we keep stretching and we keep our flexibility. Interesting thing to know is that regardless of your weight, if you're physically active, there was research for women who'd had breast cancer, and it was looking at the risk of recurrence. And regardless of their weight, if they were physically active, their risk factor of a recurrence of breast cancer was reduced. So that had nothing to do with their BMI. It was purely about how physically active they are. So physical activity is really, really important. Next slide, please. Sleep. Now, if I could say there's one area of life that becomes difficult for a lot of women post-menopause, it's probably around about sleep. Everybody knows how awful it is when you've not slept well. So poor sleep, definitely it affects your attention, your focus, your memory, your mood. A lot of people feel much more hungry, tend to opt for unhealthy foods when they've not slept well. And it does increase your risk of a lot of diseases if you're not sleeping well. So just again, a real quick, brief overview of ways to try and to improve your sleep. So I'd say there's three areas where people struggle to sleep. So the first one is getting to sleep. So the ways to try and improve that is really trying to decrease our exposure to blue light in an evening. Now, blue lights tend to be within our things like our laptops, our phones. It's the kind of electrical devices that we're using all the time emit a blue light. And the problem with the blue light that comes from these devices is that it suppresses an important chemical for sleep called melatonin. So if we're using our devices late into the evening, we're actually suppressing our natural sleep hormone that helps us get to sleep, melatonin. So trying to avoid screen use for about an hour before bed is really, really helpful. It's important to dim the lights in your house as well. So it's sending signals to your brain that it's time to start to slow down, to quieten down, and it's time to start to get sleepy. Avoiding caffeine after lunchtime is important. I speak to people who say, oh, I can drink coffee in bed and I'm absolutely fine. I can still sleep well. But actually, the quality of their sleep often isn't that good. And the reason for that is caffeine has a half-life of several hours. So even if you have a coffee at 3 in the afternoon, it's still active in your system quite late into the evening. So really, if you can cut out caffeine altogether, fantastic, but certainly trying to avoid it after lunch. Increasing physical activity is really helpful for helping you get to sleep and making you feel tired, but you don't want to be doing that right before sleep. So if you go out and do a workout, an hour before you want to go to sleep, you're going to wake yourself up too much. So you want to be pushing your physical activity earlier in the day. And then actually part of how we get to sleep is by our parts of our body warming that then cools our core. And one of the ways that we can warm up our peripheries to allow our core to cool down to initiate sleep is actually taking a bath. Now, we do this for babies. We put them into a bath as part of their sleep routine, and we know it helps them sleep. But we seem to forget this as adults, that actually being warm, putting on some warm socks, having a warm bath will actually help you get to sleep. One of the other areas people struggle with is staying asleep. So again, some tips to try and help you stay asleep: keeping your bedroom dark, making sure the bedroom is cool overnight will help, especially if you're suffering from menopause flushing. If you do wake up in the middle of the night, the last thing you should do is reach for your phone, or put on your bright bedside light as well. If you can find bulbs that have more of a red tone in them and you use them when you wake up in the middle of the night, it will help to continue your melatonin expression rather than sort of dimming that down. And then the other thing that can help is increasing your morning and mid-afternoon daylight exposure will help to keep you asleep too. So getting out in the morning for daylight, it's not easy at this time of year in Scotland, but that can make a big difference too. And then if you're waking up early, so I hear a lot of women saying they're waking up about 4 or 5 in the morning and they just can't get back to sleep. So again, top tips for that is good bed covers to keep you nice and warm in the bed, although your room is cool. Avoiding bright lights until your ideal wake up time. So again, if you've woken up at 5, try and avoid bright light until what would have been your ideal time. So if 7 is your ideal time, try and avoid that bright light until 7. If you push caffeine a bit later in the morning to when your ideal wake up time would be, that can actually help you stay asleep as well. And then another thing is moving carbohydrates later in the day, because that helps reset your circadian rhythm. So I appreciate that is a whistle stop of different ways to try and help with sleep, but there's quite a lot of science developing about different ways to improve sleep. We'll go on to the next slide, please. So I'm sure I don't need to tell you about harmful substances and how important it is to reduce them. So smoking, we all know the disease risk of smoking, disease risks from heart disease, stroke, lung disease, cancer. Actually, 1 in 3 cancers relate to smoking. So it's a really big risk factor and it's still a risk factor. But I think what we're seeing developing now is this issue with vaping. So one of the problems with vaping is that, yes, if you're going to come off cigarettes, it's a useful way of helping you come off smoking. But we're finding people are starting to vape that would never have smoked in the first place. And the concern about vaping is it's an unregulated product. So you have no concept of how much nicotine you're actually getting when you're using vapes. We're seeing young teenagers using vapes, and we have no idea the impact that this nicotine is going to have on their developing brain. So there's a lot of concern about vaping. So what I would say is if you're using vaping in order to help you get off smoking, absolutely fine, but it should only be a tool to help you get off the whole thing. It shouldn't be that you replace smoking with vaping. It should be something that you do and then you slowly reduce the vaping as well and try to come off that as a harmful product completely. Alcohol, again, we have a big problem with alcohol in Scotland. Safe levels of drinking is 14 units per week, and that's spread over 3 or more days, as opposed to having all 14 units on a Saturday night. Alcohol is the 5th biggest risk factor for death, illness, and disability in the UK. So, again, a lot of people start to drink around about menopause because they're struggling with their symptoms, they're struggling to sleep, they think it helps, they're struggling with that social anxiety. But if you're turning to alcohol, you're putting your body in risk factors for a number of these diseases. And then the other harmful behavior that I think we need to start to talk about is social media use. We talk about it a lot with our teenagers. We talk about how harmful social media is for our teenagers. It actually has a massive impact on us as adults as well. What you expose your brain to has a huge impact on how you feel. I always love the expression that comparison is the thief of joy. And if you're spending hours at a time scrolling through social media, it often has a big impact on self-esteem for women, on their value. Your body changes as you get older. And if your social media is full of bodies that have been altered, they're not a true reflection of what people actually look like, you can start to feel that you're not good enough, that your self-esteem is really a big issue. So I do think, there are some benefits to social media, but there's an awful lot of negatives. It sucks an awful lot of our time up as well. It's really easy to get addicted to scrolling, and before you know it, an hour has passed. And you've got to think about how you could have spent that hour maybe being physically active or preparing food. So it's really, it's thinking about how much time am I using in social media and is it doing me any good? The other problem with social media now is that we've lost the ability to have just some quietness and some deregulation of brain activity. So if you ever stand in a queue, you'll find it's very rare that anybody's just standing there not scrolling through their phone. We've lost the ability to just be at peace and just to have calmness. And I think that is something that is then affecting our ability to focus. It's affecting our attention because we've become so used to our brain constantly being on the go. So another reason to try and reduce social media use. Next slide, please. So healthy relationships are also a really important factor as well. I think we all can look back to the pandemic not that long ago and realize how much we need social connection. We had people sneaking out to meet with each other. We had people very isolated, becoming very down because they weren't able to mix with people. We know that humans are social beings and we need to have connection with each other. And the thing is, real life connection has been shown to be much more effective than online. Now, I appreciate online has been great for allowing families that live across different continents to be able to talk to each other. But actually being able to be in the same room as a person has a big impact on our mental health. Relationships need time. Everybody is really, really busy, but actually prioritizing time with friends and family is really important and not letting that be squeezed out. There's a really interesting study from Harvard, which initially was men that they followed up for 85 years, but then over the decades have included women. And what it actually showed was that relationships are a massive influence on how happy we are and our long-term health. They actually had a bigger impact on happiness than money or fame when they looked at it in this study. And it didn't matter what demographic people were from. Relationships was a huge part of how long people lived in this study and the kind of contentment they had with life. So relationships are really important. And we need to spend time building them. So the ways that we can do that is by joining community groups. You know, if you can build a community with physical activity and relationships, then you're hitting two of these 6 lifestyle factors that we need to be focusing on and improving. And finding people with shared interests is a really good way of building relationships as well. Next slide, please. Stress is becoming a big issue in our society, and there's 2 main hormones, if you like, that are involved in stress. There's adrenaline, which is the fight or flight hormone that gets released at the moment that you perceive that you're under threat. But there's also a hormone called cortisol, which is another stress hormone. And what we're finding is with long-term chronic stress that people's cortisol levels are at the higher end of normal all the time. And the concern is if you have high levels of these hormones, you're putting your body at risk from a number of different diseases. So there's cardiovascular risk of increasing heart rate and increased blood pressure. Chronic stress has an impact on your immune system, so your ability to fight infections. So if we're not addressing stress, you know, that can have quite an impact on our immune system. We can develop digestive issues because of stress, stomach cramps, indigestion, things like irritable bowel syndrome. And then pain becomes a lot worse with stress as well. So muscle pain and tension becomes an issue when we have chronic stress. So we get neck pain, back pain, and headaches. So again, stress is something we really need to be looking at how to improve in order to have healthier lives. Next slide, please. So how do we do that? So there's a lot of evidence for mindfulness, and particularly there's a class called mindfulness-based stress reduction. And this has been well researched at being helpful for managing stress. Another way of managing stress is to make sure that what you're doing has purpose. So acts of kindness, service to others, doing meaningful activities has been shown to be really beneficial for our emotional health. Gratitude journaling is a really simple habit to get into that can be really good for stress and for emotional health. So what you do with that is each day you just list 3 things that you've been grateful for that day. And there's good evidence that shows if you do that for a week, it actually has a positive impact on your mental health for much longer, even up to 6 months, just from 1 week of doing this kind of practice. And then the other thing is breathing techniques. So you probably hear a lot of people starting to talk about breath work and breathing techniques as a way of calming down our stress responses. The reason it works is it stimulates a part of our system called the parasympathetic nervous system, which helps us to stay calmer and feel more relaxed. And there's just some simple ways to do some breathing techniques. So one of them is called box breathing, which is where you try and find a place where you're relaxed and you inhale through your nose for a count of 4, you hold for a count of 4, and then you exhale through your mouth for a count of 4, and again, you hold for 4, and you just repeat that cycle. Now, these can be really helpful if you suffer from panic attacks or if you suffer from, you've got a big event coming up and maybe you're really anxious about it. Practicing breathing techniques can help, but in order for them to work at the crucial point you need them, you do need to practice them when you're feeling quite relaxed. So trying to pull this out the bag when you're about to go, to a big meeting and give a presentation, it's probably not going to be as effective as if you try and practice these techniques for a couple of minutes every day, and then you're in tune with them. You can pull them out when you're about to do that meeting or you're in that stressful situation, and they can help reduce your sort of panic and adrenaline surges that can make you feel really anxious and on edge. So one more slide, please. This is my last slide. And this is a real message to say, you know what, it's never too late. There is this fantastic woman in America called Joan. This is her. And if you wanted to look her up, if you look for Train with Joan, it's a woman who had been in ill health her entire life. And at 70 years of age, her daughter encouraged her to start to just sort out her health. So start to get physically active and start to eat properly. As you can see from the picture, she has lost a significant amount of weight, but she talks about the general well-being that she has, that it's not just about your body size, it's also about how you feel, about the energy levels you have, being able to keep up with her grandchildren. And she's really inspirational. So I'd really encourage you to have a little look at that. And just to really have that hope that it doesn't matter how old you are, doesn't matter if you're already in ill health, making changes will have a really big impact. My business is called Maldod Life. You're very welcome to look me up. I try and put stuff out there about healthy living, healthy lifestyle. So by all means, follow me, and, hopefully I can share tips and hints as well. But the main thing is really, it's never too late. Have hope in health and get back into the driving seat so you can feel empowered about your health going forward. Okay, thank you so much.
Thank you so much, Becky. That was so helpful. I think just having that clarity around the specifics, and just like you say, some of it's actually quite simple. It's just being a bit conscious about what we're doing, and sometimes it's just adding one thing. It's just trying one thing, and the impact that that can have. So thank you so much. Really appreciate that. And I know that a lot of people in the chat do actually. You can probably see all the wee love hearts that are flying up from the screen. So yeah, a lot of thanks in the chat. So we're going to move on now to our second speaker. So our next speaker is Professor Anna Glasier. So Anna is an internationally renowned and respected physician in the field of reproductive medicine. She's worked with many international organisations, including the WHO, and has had lots of UK appointments, including at the RCOG, and was previously the Director of Family Planning and Well Women Services at NHS Lothian. But as many of you will be aware, Anna was appointed Scotland's first women's health champion in January 2023. And we're very pleased to have her with us today. So Anna, we've had those specifics around kind of lifestyle changes that we can make from Becky. And what Anna's going to do now is she's going to highlight some experiences and some specific risks and common conditions that can affect women post-menopause. And so she'll kind of go into some detail about why maybe we as women kind of physiologically might experience these conditions after the menopause, but importantly, we'll explore kind of preventative actions that we all can take. So Anna, thank you so much for joining us, and over to you.
Thank you, Jen. Can you hear me okay? Yes.
Yep, can hear you fine.
Okay, so thank you very much. Yes, and good afternoon to everyone. As Jen said, I'm the Women's Health Champion for Scotland and have a role in taking forward the Women's Health Plan, the aim of which is to improve health outcomes and health services for all women and girls in Scotland. So a million thanks to Becky for setting the scene and telling us how to lead a more healthy lifestyle. As Jen said, I'm going to speak this afternoon, about 3 specific conditions. Next slide, please. I'm going to talk about bone health, heart health, and pelvic health. And these are all conditions which affect women later on in their lives. So to start with bone health, next slide, please. I really like this picture. Unfortunately, it doesn't show up all that well on the screen because it's too small. But this poor guy has not taken notice of Becky's advice about reducing our social media use. He is a skeleton with a mobile phone. So bone health, next slide, please. These are the risk factors for osteoporosis. So as Becky said, osteoporosis is thin bones. And if we live long enough, certainly as women, we're all of us going to end up with rather thin bones. So the risk factors are listed here, and there's 2 slides. The first of these is being female. So half of women over the age of 50 will go on to have a low trauma fracture at some times in their life due to osteoporosis. The second risk factor is being menopausal, and we know that there's quite a significant fall in bone mineral density as we go through the menopause. And if you're unlucky enough to have a premature menopause, that is a menopause before the age of 45, then you start losing bone mineral density earlier than someone with a menopause of 50, and you're more likely to be at risk in later life of osteoporotic fracture. A family history of osteoporosis is important, but particularly a parental history of hip fracture. So if your mother, or even more importantly, your father had a hip fracture, then you have an increased risk of osteoporosis. Being underweight puts you at risk of osteoporosis, particularly if you're underweight when you're very young. So girls with eating disorders who have a very low weight with a BMI of 19 or less are significantly at increased risk of osteoporosis. And then finally, if you drink heavily or if you smoke, then that too puts you at risk for osteoporosis. Next slide, please. And there are certain medical conditions that in and of themselves increase your risk of developing osteoporosis. Thyroid disease, long-term use of oral steroids for conditions like rheumatoid arthritis or Crohn's disease, diseases that are associated with malabsorption like celiac disease, some medication, particularly those used to treat breast cancer, which switch our estrogen levels down to practically nothing. And then finally, long periods of inactivity, such as long-term bed rest. So all of these things will increase our risk of osteoporosis. Next slide, please. How can we prevent it? Well, our bone density is determined by our genes, and we reach our peak bone density between the age of 30 and 35. And there's not a lot you can do to increase your bone mineral density beyond that level. The trick is to avoid things which reduce your bone mineral density. So stop smoking and limit the amount of alcohol that you drink, particularly if you smoke a lot. Eat a healthy, balanced diet, and Becky's told you how to do that, but to reduce your risk of osteoporosis, that diet has to be rich in calcium. Spend time outside to build up your vitamin D levels. That's easier said than done in Scotland because we need sun to build up our vitamin D levels. And if last summer was anything to go by, we're not doing well on that front. As Becky said, do regular weight bearing and muscle strengthening exercises. They don't necessarily increase your bone mineral density per se, but what they do is increase your muscle strength, improve your balance, and prevent you falling over. And it's when you fall over that you get a fracture. So if you have good balance, then that in itself is very good for preventing osteoporosis in later life. Consider taking vitamin D. The Scottish Government does actually advise us all to take vitamin D. They used to advise us to take vitamin D between October and March, so in the winter months when we don't get much sun. They've now said that we should take vitamin D all the year round, which makes me think that they know that we're in for a lot of rather dismal summers. Vitamin D is not expensive. And then finally, if you're menopausal and if you have menopausal symptoms and you're thinking about taking HRT, HRT slows loss of bone mineral density. So HRT is not generally considered to be a treatment for preventing osteoporosis, but it's, if you like, an added advantage of taking HRT. And when we asked a bone density expert the other day what single thing he would advise women to do if they want to prevent osteoporosis, he did actually say, take HRT. So it's something to build into the risk-benefit ratio of taking hormone replacement therapy. Next slide, please. So just to continue Becky's theme of healthy lifestyle, you can increase your vitamin D intake and prevent your loss of bone mineral density or slow your loss of bone mineral density by taking in vitamin D through your diet or by taking vitamin D tablets. And if you buy them from Boots, conveniently, the bottles come with 365 tablets so that you have a year's supply of vitamin D, unless it happens to be a leap year. Now, at a meeting that the Women's Health team and I had earlier this week on osteoporosis, we learned that 1/3 of people actually have to prompt the investigation of their risk of osteoporosis. So it's not something which GPs think about very much. And although I haven't made a slide of this, but I'll put it in the chat later, there is a site online that you can go into called FRAX, F-R-A-X, which is a 10-year risk assessment tool in which you can try and quantify what your risk of osteoporosis is going to be in the next 10 years. So if you're somebody that has had 2 fractures in their lifetime, not fractured fingers or toes, but wrist fractures, fractures of the long bones of your arm or leg, that increases your risk of osteoporosis. And I've already said the family history and so on. So you can look at the 10-year risk assessment tool online and see what your risk is. And if you're in a high-risk group, then next time you go and see your GP, or perhaps you can make an appointment to go and see your GP to discuss your risk of osteoporosis and prompt further investigations. Next slide, please. So my next topic is heart health. Next slide. And as Becky said, it's the commonest cause of death in Scotland is heart disease. And when we talk about cardiovascular disease, we're talking not only about heart attack, but we're also talking about stroke. We all of us, next slide please, worry desperately about dying of breast cancer. But coronary heart disease kills more than twice as many women as breast cancer in Scotland. And if you look at women before the age of 75, then it kills considerably more than twice as many women who die from breast cancer. Next slide, please. And the key is that while breast cancer is difficult to prevent, coronary heart disease, cardiovascular disease, heart attack and stroke is actually preventable. So next slide, please. Just a word about what causes heart attack and stroke. So a heart attack happens when a clot in one of the arteries of the heart, the coronary arteries, blocks the flow of blood. So the blood flow to the heart is blocked. That bit of the heart, which is supplied by that vessel, is deprived of oxygen, and the heart muscle is damaged or dies. A stroke has a similar mechanism. It's a clot in one of the vessels, but this time in the brain, which blocks the flow of blood. The part of the brain where the clot occurs no longer has sufficient blood supply, and that part of the brain dies. And then there's a second type of stroke, which is slightly less common, which is called a hemorrhagic stroke, which is when a blood vessel bursts and bleeds into the brain. So the bit of brain beyond the blood vessel is running out of decent blood supply, and that damages brain tissue. So heart attacks and strokes are due to clots or hemorrhagic stroke. What can we do to prevent them? Next slide, please. Oh, first of all, next slide. You can actually calculate your heart age. Just as you can calculate your risk of osteoporosis, you can go onto the NHS website and you can calculate your heart age. And if you find that you look as though your heart age is considerably older than your actual age, then you need to go and see your GP and talk about how to prevent your risk of heart disease. And how to do that? Next slide, please. So I begin to sound like a cracked record. Stop smoking and drink less alcohol. Eat a healthy diet, be physically active, and watch your weight. But also be careful to take your medication. If you have hypertension and you're on treatment to reduce your blood pressure, or if you have diabetes and you're taking medication for diabetes, you need to be assiduous about taking your medicines, because they not only treat the condition for which you're taking the medication, but they reduce your risk of heart attack, stroke, kidney disease, and so on in later life. And the good thing about the guy with the skeleton that is carrying his mobile phone is that you can set your mobile phone to go off every day to remind you to take your medication. So modern technology sometimes helps. Know what your risk is, and you can find that out, and then know the signs and symptoms of having a heart attack or a stroke, because if they happen, you need to act quickly. So the symptoms of a heart attack are shown in the next slide. They're not always the same for women as they are for men. Can I have the next slide, please? So they vary from person to person, but classically they include pain or discomfort in your chest, particularly in the left side of your chest, which comes on quite suddenly and doesn't go away. The pain can spread more usually down your left arm, but sometimes down your right arm or up into your neck, jaw, back, or stomach. And for some people, the pain or tightness is severe, while for others it's merely uncomfortable. It may feel like heaviness in your chest or a burning pain similar to indigestion. You may also feel sick, sweaty, lightheaded, or short of breath. And shortness of breath is an important way that heart attacks present in women rather than in men. So if you think you might be having a heart attack, then don't hang around, because the sooner somebody deals with you, the more likely you are to make a better recovery or recovery at all from a heart attack. Symptoms of stroke are shown in the next slide, please. So facial weakness. Can the person smile? Has their mouth or eye drooped? And it's more likely that you will detect somebody else having a stroke than that you will detect that you're having a stroke yourself. So arm weakness. Can the person raise both arms in an equal manner? And is the person having speech problems? Is the person's speech becoming slurred? Can they understand what you're saying? If any of these things are happening, then that person or you could be having a stroke, and you need to act quickly, because there are now treatments to stop the stroke in its tracks. So you can have clot-busting drugs, you can even have the blood clot removed from the artery in the brain, but only if you present quickly. So if you think you're having a stroke or somebody else is having a stroke, then dial 999. And my advice is, if they tell you it'll be 4 hours to get the ambulance, then call a taxi or a friend to take you to hospital. Next slide, please. So the last part of my talk is about pelvic health. And this is something too which tends to worsen in later life. This is a picture of the pelvis with the bones, the bottom of the backbone, your two legs hanging off the bottom, and coloured in sort of orangey colours are the muscles of the pelvic floor. And the muscles of the pelvic floor is what holds everything in place inside your pelvis. Next slide, please. So, as I say, the pelvic floor muscles sit at the base of your pelvis. They help to keep your bladder, your uterus, your vagina, and your bowel all in the right place. And all bladder and bowel function needs good pelvic floor muscles. So when you need to go to the toilet, you don't know this, but you use your pelvic floor muscles to prevent any leaks. And life events like having a baby, particularly, or aging, can impact your pelvic floor muscles. But it's never too early or too late to start exercising your pelvic floor muscles. And there's a very good section in NHS Inform to tell you how to do that. Pelvic floor issues are not an inevitable part of aging. So don't just dismiss the fact that you may be developing incontinence as a factor of growing older, because there are things that can be done about it. And maintaining a strong pelvic floor may help prevent issues in the future. These are the stats in the next slide, the statistics about urinary incontinence. It is surprisingly common. So in a postal survey, which was done in a single general practice in the United Kingdom among women over 21 years registered in that practice, 40% of respondents admitted to suffering urinary incontinence. And in about 1 in 10 women, it caused significant problems. But only 17% of women with significant problems had sought professional help. Most people just tend to try and live with incontinence, thinking that it is an inevitable consequence of aging or an inevitable consequence of childbirth. And people perceive urinary incontinence as natural, and so they don't go and seek treatment. They also don't go and seek treatment because they're embarrassed. And if you go and see your GP or your practice nurse, there are plenty of things that can be done to help urinary incontinence. Next slide, please. Even less likely to be talked about, and an even more embarrassing condition, is bowel incontinence or fecal incontinence, which is defined as the unintentional loss of either solid or liquid stool, so leaking from your back passage. And it actually occurs in up to 1 in 10 adults who live in the community, that is, who aren't in an old folks' home when fecal incontinence is much more common. It can markedly impair the quality of life. It isn't something to be ashamed of. It's simply a medical problem, which is no different from diabetes or asthma. It can be treated, and there is a wide range of successful treatments. It isn't a normal part of aging, and it doesn't go away on its own. So if you have bowel incontinence, don't be embarrassed to go and see your doctor to get advice about how to manage it. Next slide, please. So what can be done about bowel incontinence? Lifestyle and dietary changes to relieve constipation or diarrhea. Exercise programs to strengthen the muscles that control the bowel, and those are the same muscles that control the pelvic floor and therefore control the bladder. Medication to control diarrhea and constipation, and there are now quite a lot of surgical options to treat bowel incontinence. So if you have bowel incontinence, or you know someone who has told you they have bowel incontinence, don't just put up with it. Next slide, please. So what can you do to improve your pelvic health in general? So here's the crack record again. Watch your weight. If you are seriously overweight, you're putting a lot of burden on your pelvis. So you are more likely to get a prolapse. You are more likely to be incontinent. So be careful to watch your weight. Stop smoking. If you have a chronic cough, you're very likely to have chronic incontinence. Every time you cough, you leak. Do pelvic floor exercises. They're not difficult to do, and as I've said, you can find out about them on NHS Inform. If you're post-menopausal, consider vaginal estrogen. When you go through the menopause and the ovaries are no longer producing estrogen, the walls in the vagina get thinner and less muscular and more fragile. They often manifest themselves with a bit of vaginal bleeding, but they can also manifest themselves with poor pelvic health. You can speak to your GP about getting a very small dose, but an effective dose of estrogen to improve the walls of the vagina. You can also actually buy it from the pharmacy, try it for a month, and then get it prescribed by your GP if you're embarrassed to go and see your GP to talk about vaginal dryness or incontinence. Cut down on caffeine. That was advice from Becky earlier in this presentation. And modify your fluid intake. If you don't drink enough fluid, then you tend to get constipated. If you drink too much fluid, then you're putting more of a burden on your bladder, and you're more likely to suffer from incontinence. So it's a balance, as so many things in life. So I think the next is my last slide. The key to your future health: don't smoke. If you do smoke, stop. Drink alcohol in moderation. Be physically active. Watch your weight. Don't be embarrassed to see your GP. And there's one more slide, I think. Don't be intimidated about seeing your GP. And I think that we are intimidated about going to see our GPs. We sit in the waiting room and we see notices which say, one problem, one appointment. And a lot of people, women in particular, and I think women are more likely than men are, to be intimidated by these sort of subliminal messages that the GPs are very busy and we shouldn't be bothering them. Try and ignore that feeling. Go and see your GP and be direct about what the problem is. But I'll just finish by saying all of these things are much easier said than done, but I think Becky started this presentation by giving you a whole host of really good tips on how you can improve your health, your lifestyle, and lead a healthier life. So thanks very much, Jen, and that's it from me.
Thank you very much, Anna. That was so helpful. Again, it's that whole thing of there's risks that we need to be mindful of, but they're not insurmountable, and there's so many opportunities throughout our life that we can kind of aim to prevent some of these. So thank you very much. And again, lots of thank yous in the chat and lots of thumbs up and claps. So thank you. We have about 10-ish minutes for some questions, so I'll try my best to speed through a few. Now, there's quite a few questions that I'm just going to try and group together here around activity, physical activity. You both spoke about the importance of exercise and the importance of moving our bodies, both for our kind of health overall and also for specific conditions. So my first question is around if somebody here has already been diagnosed with osteoporosis and they're very aware that increasing their exercise will support their health overall, but they're scared of falls, they're scared of stress fractures, and generally the kind of risk of aggravating the condition. So, what would you recommend as a kind of first step for somebody that's already been diagnosed with osteoporosis, but they really want to up their exercise? Anna, I don't know if you want to jump in first, and then Becky.
Yeah, sure, I can start. So probably better not to go skiing or ice skating or hang gliding. Bungee jumping might be all right because you kind of bounce at the end of it. But I think the message is take it gently to begin with. As Becky said, a half an hour walk for 5 days a week, and you can use sticks. People don't no longer generally use a sort of an old-fashioned walking stick. If you get ski poles, you look like you're a fitness fanatic, not somebody who's old and worried about their bones. So concentrate on your balance, be realistic about what you can do, and do a bit of weight training. And if you go to a gym, some people do, if you have access to one episode of seeing a personal trainer, they will give you advice about how to do things which don't increase your risk of fracture, but at the same time, which improve your bone mineral density and particularly improve your muscles and your balance. I remember Michael Mosley once saying, stand on one leg while you brush your teeth. That improves your balance. It's pretty simple. But if you have osteoporosis and you're worried about a fracture, use the hand that isn't brushing your teeth to hold on to something. Becky, what do you say?
Yeah, totally agree. I think build your confidence with it. By building the muscle, you're going to be more likely to have that ability to rebalance if you do lose your balance. And yeah, I think the sort of sports you mentioned there, Anna, are probably best to be avoided unless you're already very proficient at them. Something that I've started to do that's a really easy thing is actually use a weighted vest. So you can buy them from Amazon, and there's different weights. 2 kilos, 5 kilos, you wear it like a little jacket and just do your housework wearing a weighted vest. Or go for the walk wearing the weighted vest. So it's a way of getting a bit of strength training, and it's just a little bit more intense than just doing those physical activities without it. But a super simple thing. You can be in your own home, you can feel safe, not be worried about a fall. So yeah, but I do think getting an expert, there's some brilliant fitness instructors out there who will take you through a program that then you just follow each week. It doesn't need to be that a huge amount of money. One session often is enough to give you a program that then you just go away and work on yourself. The other thing is there's a lot of councils, certainly where I work in Lanarkshire, we can refer people for physical activity prescriptions, which is at the local gym. So again, have a chat at your GP surgery, community link worker, different people at the GP practice that might be able to get you connected in with local services, either at a very reduced price or even for free, that will build your confidence in physical activity and set you a program. Because what you don't want to do is, if you don't move at all, nobody's expecting you to do 150 minutes next week. It's building it at a pace that is realistic and building up slowly. So yeah, just ask for help. Don't be afraid to ask for help.
Thank you. Thanks both. And somebody in the chat has said, Tai Chi, for example, is something that can get you moving, but it's not, a lot of stress on your body. Somebody else speaking about even just doing housework around the house can again, it's getting you moving. Another question linked to physical activity and also around pelvic health. You've both spoken about the benefits of weight training for women kind of throughout their life, but especially in later life. And the question is around how do you balance the weight training with kind of protecting your pelvic floor? Because I think sometimes bearing heavy weight can stress the pelvic floor. So how do we find that balance there? I don't know if Becky, you were nodding. Do you want to come in first, and then Anna? if you'd like to come in.
Yeah, I think that there are certain compound big moves that are maybe more at risk at putting a lot of pressure through your pelvic health. So again, to your pelvic floor, sorry. So again, speaking to a fitness instructor who understands something about women's health will be helpful to set you a program of weights. The other thing is you don't have to lift really heavy. It can sometimes be a short number. So people think, oh, I must build the weight every single time, but actually you could build the reps. So you could lift a lighter weight more often as opposed to necessarily, building really deadlifting huge amounts of weight that puts a lot of strain through your sort of intra-abdominal core. But again, if you're doing your pelvic floor exercises and building your strength there, the key is when you're doing weightlifting is to really make sure your technique is good, so not just throwing weights on and having a go at it, but actually, really looking at your form, making sure your form is good, that you're positioning yourself, you're holding your abdominal muscles in the right way. So again, it may be that you need to get a couple of sessions with somebody just to teach you how to have good form, but it isn't something to be afraid of. You can definitely adapt if you've got pelvic floor issues. There are lots of ways of helping that. And there's pelvic floor physios who are specialists in sport as well. So I'm aware of quite a few pelvic floor physios out there for runners, because one of the things that women can have issues with is if they've got like a prolapse when they run, sometimes the prolapse moves and it can become quite uncomfortable. But there are specialists out there in that area. Now, yeah, you might not be able to get that on the NHS. It depends where you live. But being aware there are specialists out there that you can go and see who are particularly pelvic floor for runners, pelvic floor for, so that people are starting to realize this is really important, and you will find help out there.
Thank you, Becky.
And Becky, personal trainers are expensive. So is there something somebody can do to get advice about weight training or strength training, which isn't going to exacerbate their urinary incontinence, other than if you do a particular exercise and you leak, don't do that one?
I think there's a lot of free advice now. I mean, although we said about how terrible social media was, there are some benefits to it. There is a lot of really excellent people out there who are trying to put messages out. So YouTube has some brilliant videos on it. Instagram, following different healthcare professionals that will give you advice about how to manage it. But yeah, it is expensive, and it's not always going to be possible for everybody. But again, asking in your area whether or not there's some help within the physical activity prescriptions. It just depends where you live as to whether that's going to be available through your local council. But there's definitely a lot online, a lot on YouTube that can give you advice about managing these things.
Just don't look at it for the hour before you go to bed.
Absolutely. Yeah.
Yeah, and I think a good rule of thumb, isn't it, with social media, is that if you're looking for, medical content, follow a medical professional who is specialist in that particular area.
Absolutely.
Thank you both. And also, I mean, I think a lot of community groups as well, women's community groups that maybe have exercise classes and things like that, they often bring in speakers who might have a kind of a specialism in a certain thing, so that it's explore what's out there in your community as well, because there is lots, and again, it taps into what you were saying, Becky, as well, about social connection being important for us too. I'm just conscious of time. I'll two more questions, and I think unfortunately we'll have to wrap up. So one is just a bit of a kind of overall one around nutrition. We've had quite a lot of people put things in the chat about diet, and one question is around there is a lot of information out there about what we should be eating, about what the carnivore diet versus the Mediterranean diet. And so it's just a little bit of clarity around when we're thinking about things like protein, when we're thinking about things like fiber. Is there kind of recommended amounts for women particularly that we should be aiming for?
Yeah, so I think from a fiber perspective, you're looking for a minimum of 25 grams of fiber a day for women, and most people are not hitting that by a long way. And from a protein perspective, this is a really interesting one, because I think if you speak to fitness instructors, people in the gym, they'll be like, a gram of protein per kilo that you weigh, and really quite significant high levels of protein. But actually the science, the evidence says that 0.8 grams per kilogram is probably enough protein. If you eat more protein than you need, you will just turn that into energy. It will be turned into fat stores. So yes, I think getting more of your calories from protein as opposed to carbohydrate is going to be useful. But you only need a certain amount. Your body doesn't need some of these high levels of protein that are quoted by the kind of gym industry. And that's really because that's about building a body aesthetic. And we've kind of blurred the boundaries between what's for health and what's for a particular body aesthetic. So yes, definitely we don't eat enough protein. We have a very carbohydrate rich diet in the UK, but some of the amounts of protein people are trying to eat, it's very difficult to do it without actually taking a lot of ultra processed forms of proteins. If you look at your protein shakes and some of these products that have that claim high protein, so you think you're doing the right thing and eating it, but if you look at the ingredient list, it's often full of just chemicals and it's not actually that useful for you. From a point of view like carnivore diet versus other diets, at the moment, the most evidence-based diet, which means the most studies have been done on it, is the Mediterranean lifestyle type diet. And that's a very varied one. It's the whole grains, there is meat and fish in there, lots and lots of plants. There is carbohydrate in there, but again, it's the whole grain carbohydrate. And the thing about that particular way of eating is it's really easy to stick to. Loads of people go for the keto diet because they lose weight quite quickly, but trying to stay on a keto diet is incredibly difficult to maintain for the rest of your life. So again, as I was saying, this opting in and out of diet is not looking about your future health. It's more like a fad for now to drop a dress size for the summer. Whereas actually what we're trying to do is not just lose weight, we're trying to nourish our bodies, to give our bodies energy, vitality, and to age well as well. So I think that's an important thing to think about. This isn't just about weight loss, which women are often, bombarded with sort of your self-esteem is tied up in your size, which is completely wrong. But we have this kind of media aspect that's telling us that we're not good enough if we're a certain size. So I think we need to take nutrition away from just being about weight loss, and nutrition is about so much more than weight loss. It's about fueling ourselves properly as well.
Thank you, Becky. Anna, have you got anything final to add?
No, I don't think I can add anything to that.
Perfect. I was hoping for another question, but I've just realised the time. So I'm going to have to wrap up. Thank you so much to Becky and to Anna. I think that was just fabulous. And you can see from the chat, there's just so many comments about how helpful and how much clarity this conversation has brought. So thank you both. Thank you also to Jackie and to Neve for interpreting, and for yourselves for coming along today. For more information, see the links in the description box below.